Hello, everyone. Welcome to the University of San Francisco School of Nursing and Health Professions informational webinar. This webinar will focus on the family nurse practitioner and psychiatric mental health nurse practitioner, Doctor of Nursing program. We want to just let everyone know that we appreciate your time this evening to want to learn more about our nurse practitioner programs, and we're excited to offer this to you. Please feel free to ask questions throughout the presentation. We will have time at the end of the webinar to respond to questions. And just wanted to let you all know that this webinar is being recorded for those that would like to take some time to review the material again. Also, for those that weren't able to make it this evening, they'll have an opportunity to view the webinar as well. And all attendees will be receiving an application fee waiver in case you want to, in the hopes that you would like to apply to our program. So I'd like to introduce who we have here tonight. We have Alexa Colgrove Curtis, and Dr. Curtis is the Associate Professor and the Director for the Nurse Practitioner Programs. We also have Judith Karshmer, and Dr. Karshmer is Professor and our previous Dean in the School of Nursing and Health Professions. She's also the Director of the Psychiatric Mental Health Nurse Practitioner Program. And I am Carolyn Arroyo. I'm the Graduate Enrollment Manager for the School of Nursing and Health Professions here at USF, and I will be moderating this webinar. So just a brief, just an overview of what we're going to be discussing today. We will provide a brief overview about University of San Francisco and the School of Nursing and Health Professions. We will also be talking about the history and the purpose of the Doctor of Nursing practice, the DNP, program delivery, program goals and details, clinical practicum requirements, program final project, of course, the family and psychiatric mental health nurse practitioner, and then we will also have a question and answer section, a Q&A, towards the end of the webinar. And so now I'd like to turn it over to Judy, who will be doing the first part of the presentation.
Hi, everybody. Welcome to our webinar. We're delighted to have you here. Let's go to the next slide, yes, because I get the great opportunity of talking a bit about the University of San Francisco. Many of you, I'm sure, know about our school and its 150-year-old tradition in the city of San Francisco. We have been the city's university since the mid-1800s, when the first Jesuits came to minister to the 49ers, those 49ers. And we have the School of Nursing opened after World War II. It was, in fact, started by the Sisters of Mercy at St. Mary's Hospital, who came and asked the Jesuits if they could have their nurse students finish their bachelor's degrees. So we've been educating nurses for the Bay Area for dozens and dozens of years. Nursing and health professions added the health professions component as we realized that the way forward in healthcare was an interprofessional approach, and we added other programming and changed our name. We also at USF have a School of Management, a School of Law, the College of Arts and Sciences, the largest college on campus, and a School of Education. We're the first university in San Francisco and the second oldest institution for higher learning in California. And if you've ever been to our campus, the steps you see is in the heart of the campus. Next slide, please. So I want to just tell you a little bit about the programs in the school. As I indicated, we are more than a school of nursing. We have a very I think, sound and quite popular Bachelor's of Science degree in nursing. We enroll students every fall and spring and graduate about 80 new baccalaureate students every fall and spring. We also have a BSN 4+1 program, we call it, for students who are, usually they're transfer students and have some extra credits, are able to finish out their baccalaureate degree and earn their master's degree in an extra year, a calendar year. We have included in our portfolio a Master of Science in Behavioral Health, a Master of Science in Health Informatics, a Master of Science in Nursing. We have both a Master's of Science in Nursing for the non-nurse, a Master's Entry Program. And we have that both on the San Francisco campus and as well as in Orange County. So those of you that are joining us in Southern California, we actually have a master's entry program at the Sisters of St. Joseph of Orange in Orange County. And then we have a Master of Public Health program. The Masters of Public Health program is both on this campus as well as in the Sacramento campus. We also have in Sacramento a Bachelor of Science program nursing with the Northern California VA system, as part of a VANAP nursing and a VA program that really prepares new graduates with a veteran-centric focus. We have doctoral programs in the school. We have the Doctor of Psychology and Clinical Psychology, a PsyD. It's a nice complement to the clinician programs in our DNP. And then, of course, we have a Doctor of Nursing Practice. That's why you all are here, not only in the clinician roles of family nurse practitioner and mental health nurse practitioner. We also have population health doctoral program, as well as executive leadership, in which master's prepared nurses from literally all over the country fly in for teaching intensives over the course of a 2-year period. Next slide, please. So you will sort of hear the theme that the School of Nursing and Health Professions at USF has a number of firsts. Not only were we the first institution of higher learning here, we were in fact the first to offer the Doctor of Nursing practice. Back in 2000, we opened our doors back in 2007, and we were quickly able to get the approval of the state bodies that have to approve new programming, as well as the Commission on Collegiate Nursing Education. Our programs are also approved by the California Board of Registered Nursing. We started the program as both a post-baccalaureate program for nurses with a bachelor's degrees to earn a DNP, and a post-master's DNP program. So we have different kinds of learners, but really focused on helping them achieve this end of and the highest level of education with the Doctor of Nursing practice. Next slide, please. So the School of Nursing and Health Professions, we really have identified that we prepare health professionals who provide a moral compass to transform healthcare in order to promote equity and positively influence quality delivery and access. We talk about the 3 pillars of our school as the San Francisco advantage, and what that really means is you don't have to be in San Francisco, but it's that entrepreneurial, can-do, we have room for diversity, we bring many people into our world. That kind of an attitude is pervasive across the university. A higher standard, it's not just good enough to be smart and able, you also have to care. And we talk about the fact that you've got to really put your heart and your head into the work that you do. And a passion for justice is a direct result of the fact that we were initially started by Jesuits who really have as foundational social justice caring for those with the least among us. And what a more important time in our culture and in our world to have really know that it is truly justice for all that is makes for our profession as well as for our lives the most important part living. The mission of the school is to advance the nursing education within the context of the Jesuit community, and we focus on diversity, social justice, leadership, and critical thinking. Our tagline is change the world from here. And I have not ever been to a graduation ceremony that, whether it's an undergraduate student or a doctoral student or any kind of student who has not echoed that sentiment as something that was a big part of not only why they chose USF, but has transformed the way they think about their role in the world. Next slide, please. So what is a doctor of nursing practice? I'm sure many of you know that it was, I think, the early 2000s that there was a huge groundswell of interest in making the doctor of nursing practice the entry into advanced practice nursing. And in the IOM report, with the projection that by 2015 APRNs should be prepared at the doctoral level, there was a huge flurry of work around what does that mean for the master's degree. The master's degree, if APRNs are no longer prepared at the master's level, then what is that for? And there's been a lot of work around that. And then, of course, moving the NP role, the CNS role, the midwife role, and the CRNA role to the doctoral level has, I can remember we opened our program, there were under 25 programs in the United States. There are now over 200 DNP programs in the United States. We believe that because we started early on in this, we have learned a lot from our students and from our faculty, and have been able to do some rapid cycle reinvestment in our programs in terms of really trying to hit the sweet spot for a university like ours. The DNP is advanced educational credential for those who really want the very highest level of practice knowledge, but are not wanting to become researchers. We love researchers, and if anybody out there is teetering between a PhD and a DNP and you think you want to be a researcher, yay, we need researchers. But our focus is on the practice doctorate, and we think that this is exactly what a university like ours, which is really focusing on outreach, community partnerships, and really helping develop and advance the clinical role in an innovative way is what we are all about. So the DNP programs prepare nurses with the highest level of scientific knowledge to ensure the best quality of care and positive patient outcomes. Next slide, please. So why USF? This is an interesting question. I have been here now for 11 years, and I had never been to a Jesuit. I didn't know much about Jesuit education, and I cannot speak more highly about the fact that imbued across all of our programming is this notion that we have this passion for justice. We do believe in a higher standard, that we really think that it's educating the whole person. It's not just about educating them in one domain. We believe that the DNP is the preferred degree for NP practice. Our colleagues in the professional organizations agree with that. We also are pretty sure that one of the wonderful things about nursing is that it's not a one-size-fits-all profession, and that we have multiple curriculum opportunities given the fact that we're a school of nursing and health professions. For instance, a post-baccalaureate student could earn a DNP as a Psych NP or FNP without ever finishing a master's degree. They can go straight on through. And that has some consequences for what that program looks like. We are very big CNL school. our master's in nursing is in the CNL role, and even if students never work in a CNL role after they graduate, that CNL skill set around quality and safety has been a really important part of our program. So students can learn their master's of science in nursing. They can earn a master's of science in behavioral health. That's been particularly attractive to some of our family nurse practitioner students who really see that a lot of what they end up practicing in the practice settings require more knowledge and expertise in behavioral health. And then another very attractive is the Masters of Public Health that you could earn along the way. There are opportunities for health informatics as well, and I think that as we try to respond to the changing needs of the student who's coming to become a nurse practitioner, we really try to exploit the power of being in a school of nursing and health profession. We really believe that our programs should be accessible, they should be high quality, and we have what we try to continually tweak is what's the right mix of on-ground, in-class, online, hybrid teaching. How can we know it shouldn't be all or nothing one way or the other? And we work with our faculty and our students to try to have that sweet spot. Our faculty are clinical experts and scholars. They publish, they advance the profession through innovation and writing, and you'll see USF faculty at almost every major conference you go to, delivering podium presentations, keynotes. It speaks to the caliber of our faculty, and we have extensive support for clinical training opportunities. We have opportunities that we continue to focus on the very best clinical experiences for our students and using some innovative approaches. Next slide, please. Let me just say a few things about the DNP Essentials. This is a document that came directly from the American Association of Colleges of Nursing, has set the stage for all the development of the DNP, and has not been changed yet. These came out in the early 2000s, and there have been a couple of other documents that have tried to clarify a few things about the DNP and what the title of the final project should be like, what should constitute clinical, what should be the nature of that final product of a doctorally prepared nurse. But the AACN is embarking on their strategic plan that in the next, I think, 3 years, will be revisiting the DNP Essentials, the BSN Essentials, and the MSN Essentials. In the past, those have all been done separately, but I think wisely AACN is trying to have a timeline where they look at all three of them so they can really look at leveling between the BSN, the MSN, and the DNP Essentials. So that keep that, that'll be happening in a few years. You can read on your webinar the essential key pieces, but I want to point out 2 points. If you look at all of the first 7, those are the things that we really think are so important to advancing the last thing, which is the advanced nursing practice. So the role of the NP is around that advanced nursing practice, but we believe that the doctorally prepared NP really has a scientific underpinning. They have leadership and systems thinking. They use analytic methods for evidence-based practice. They are steeped in information technology, analytics. Policy is a big part of what a doctorally prepared NP needs to be participating in. And then population health, improving the nation's health, and then interprofessional collaboration for improving patient outcomes. One of the whole reasons we have this in a School of Nursing and Health Professions is to try to make sure that we have interprofessional opportunities. I know my colleague, Dr. Curtis, just had a wonderful interprofessional day with her NP students with another university. So we value that very highly. Next slide, please. So there is increasing demand for the DNP. I mean, have you noticed how much things change and how much more we have to know? The whole issues around quality of care and patient safety, We see it in the schools. The number of doctorally prepared faculty is really getting hard. As we increase our faculty size, we need to increase doctorally prepared faculty. So many fabulous clinicians decided they didn't want to get a doctoral degree because they really didn't want to step away from the bedside, or not the bedside of the direct patient care. So they didn't want to do a PhD. So this is really opening the demand for the DNP. Amazing, like the number of programs that are out there. We want to be at the table. Nurses need to be doctorally prepared, as are the other health professional colleagues. We know that there are outcome data that show the more educated the nurse, the improved patient outcomes. As I said before, we want doctor prepared researchers, we want clinicians, we want them to learn to work together, and having the DNP alongside of a PhD is the best of all worlds, both as a research focus, as a practice focus, and then in a school of nursing. I think that those of you that are interested in a teaching career eventually can, I think, easily see how continuing in your role as a nurse practitioner can inform better teaching, and how teaching can inform your practice as an NP. Next slide, please. So I believe my colleague, Dr. Curtis, is going to now step in.
Okay, yes, I'm here. Thank you, Judy. I hope you all can hear me just fine. As Dr. Karshmer discussed previously, I did just finish up Interprofessional Education Day with our NP learners on the University of the Pacific Stockton campus. Every year we do a Medicare Part D community event with our PharmD colleagues, and it's a really fabulous experience. So I am in an office right now off campus with a air conditioner blowing above me, so I'm sorry for any extraneous noise. Go ahead and advance the slide. Okay, so you are on this webinar because you are potentially interested in becoming a nurse practitioner. I don't think in this day and age we need to spend a whole lot of time on talking about what a nurse practitioner does. At our university, we offer 2 nurse practitioner roles, family nurse practitioner and psychiatric mental health nurse practitioner, and both of our nurse practitioner roles culminate in the DNP degree. What we know is that as access to primary care has been increased through the ACA, that there is an increasing demand for nurse practitioners. I would recommend, if you're interested in this, to take a look at, there's a research document put out by UCSF. It's called Health Force, and it outlines the primary care providers in California. It looks at MDs, PAs, and NPs, and the summary of the research article is we need more NPs. Next slide. Okay, continue. So we offer our NP programs are within our DNP degree. And so all of our NP graduates graduate with a DNP degree. There are other programs where they offer a NP with an MSN degree. We do not have an MSc degree. We are meeting the expectations of our profession by graduating only doctorally prepared NPs. And I can tell you I have watched this dialogue change over the last 4 years. 4 years ago at national conferences, there was some still critical tension between the master's programs and the DNP programs, and what should be the entry-level education for nurse practitioners. I have watched that completely switch, and now at the national meetings, there really is no tension about making the DNP the terminal degree for nurse practitioners. And in fact, a representative from our one of our accrediting organizations stood up in December and just said, you as a profession need to pull the plug and just make this the terminal degree, just like the PTs have done recently. So it is exactly where the profession is expecting that we go, and the market is expecting we go. Next slide. Okay, so the program goals, and I'm not going to read all of these, but basically what we are expecting is that our learners come out with the competencies, the knowledge and competencies to be able to provide primary care services, either in the role of the family nurse practitioner or the psych mental health nurse practitioner. We also, as Dr. Karshmer discussed, we integrate our social justice mission throughout all of our competencies and all of our courses, and we expect that our NP learners will be applying their knowledge and abilities to move the Jesuit mission forward of a more humane and just world. And of course, what an NP does is diagnose, treat, and evaluate. Those are the expectations. And then when you combine the NP with the DNP is the expectation of scholarship and leadership. And as Dr. Kirshner already discussed, the difference between a practice doctorate and a research doctorate, our competencies are about improving the systems of care along the lines of the best available evidence. Next slide. Okay, so our program delivery, and I apologize, there is a phone ringing, but I'm in someone else's office, so I don't know how to turn that off. So we have full and part-time options. Now, full-time option for graduate students is a little bit different than for undergraduate students. So in the full-time option, the learners are usually taking anywhere between 6 credits and really 10 to 12. 12 is really the top we will ever see with a full-time graduate student. Part-time options, we work very closely with our students to make sure that we can make a curriculum pattern that works for their needs. We are very consciously a program that is designed to support the advanced education of working professionals. We understand that our students are working as RNs predominantly. And so we have, as Judy has already talked about, we've done a lot of rapid cycle work in trying to find the sweet spot in how to best deliver this material to working professionals. Currently, the NP programs meets twice a month. Most of our NP courses are on Fridays and the DNP coursework on Saturdays. Currently, the NP coursework is face-to-face twice a month. The DNP coursework is delivered in more of a hybrid, online, distance accessible modality. Currently, the DNP coursework, the expectation for seat time, synchronous work, so that you are with your class on campus once a month. Now, that being said, there are some DNP courses that expect synchronous work once a month, but you don't necessarily have to be on campus. Many of the courses, like my own, I teach applied data analysis in the DNP. All my courses are Zoom accessible, web accessible, so you participate in a synchronous 8 to 12, like tomorrow morning, 8 to 12. You have the option of either coming and taking your class, participating on campus in the classroom where I will be, or you can Zoom in remotely. Courses vary in terms of their seat time expectation, but for the DNP coursework, it is once a month synchronous. And then the master's, as Dr. Karshmer discussed, one of the unique options we have at USF is for our BSN to DNP learners to complete a secondary master's along the way. So we have tracks for BSN to DNP without a master's. We have tracks for master's prepared nurses to receive their DNP, and then we have tracks for a BSN to DNP to receive a master's degree along the way. And Dr. Karshmar would discuss some of those. They are the CNL, the MSM, which is the CNL role, the MPH, and the Master's of Science in Behavioral Health. Next slide. So I talked already about some of our program options. This will help you because now you can just look at it. But we have the BSN to the DNP, we have the MS to DNP, and then we also have a postgraduate certificate. So to be eligible for the postgraduate certificate, you must have completed the DNP degree already. Many of our learners are interested in dual certification, so perhaps they will come and they will do the family nurse practitioner with the DNP degree, and then they will stay or work toward concurrent dual certification in the psych mental health NP. And then all those other acronyms behind, like say the family nurse practitioner, the MSBH is the Master's of Science Behavioral Health, the MSN CNL is the Master's of Science in Nursing, and the MPH is the Master of Public Health. As it said on the other slide, I forgot to mention that the master's coursework may be offered during the week, but there are also online master's course options. So, for example, the MPH is delivered both in person on the USF campus and the Sacramento campus, but there's also an online option. So our BSN to DNP students can, along the way, participate in the online MPH. And the same thing with the CNL. We have an online CNL option. We don't currently have distance accessible online option for the MSBH. And whatever track you choose along to the DNP degree, there are very individual reasons to choose one of these tracks. I will tell you, if you have any interest in a secondary master's, now would be the time to do it. You'll never have a more streamlined, efficient, cost-effective way to receive a master's degree along as you proceed to the DNP degree. We've worked very hard with these curriculum tracks not to duplicate curriculum. And so I highly recommend that if you are at all interested in this, that do it now. And what would be the reason to do a master's? It does add a robust element to your resume. For the MPH student, you become an expert in population health, which is one of the big topics these days. For the Master's of Science Behavioral Health, integrated behavioral health and primary care is another huge topic these days. And the CNL the Master's of Science Nursing is already a strongly recognized degree as a nursing leader in system change. Next slide. Okay, so I really already went through this, and these this presentation will be recorded. These slides are accessible to you so that you can just take a look at them and spend more time on each topic, but this just outlines the master's degree tracks that are available to you as part of the DNP option. Now, I will take a moment to say, so why would someone choose a straight BSN to DNP? There are less units to go straight from the BSN to DNP, so there is some efficiency in there, and that is a popular track. Our learners, it varies, but I would say at least half of our learners are BSN to DNP, if not more. Maybe more like 3/4 of our learners are BSN to DNP, and a half to a quarter are the postmasters of DNP. It often comes up. One of the questions I often get is, do I need experience to apply to the BSN to DNP program? And No, there's no years of experience requirement that you can apply straight out of your pre-licensure program. And our classes will vary. I will have everything from the brand new RN right out of a pre-licensure program to someone with 30 years experience in the NICU. And that's what makes our classes so dynamic. You know, there's a lot of learning, yes, that happens with your reading and your other resources and your learning activities, but to me the most robust learning happens by gathering a group of dynamic and dedicated professionals in one room and let them explore the issues of healthcare. And that's the intangible that you get from participating in a program like ours. Okay, next slide. Is there a next slide? Oh, there we go. Okay, so clinical practicum hours. All right, to meet the requirements for a DNP degree, you need to have 1,000 hours of supervised clinical practice. So in the nurse practitioner tracks, much of that is taken care of by 630 hours of direct patient care that you'll be participating in the NP program. And then the rest of that is made up by DNP clinical practicum hours, and those hours are used for you to organize and develop and implement your DNP project. So one key attribute you should always look for when you're choosing an NP program is how are the clinical placements organized. And as Dr. Karshmer already discussed, we have a robust database of clinical placements. We have partnerships that we use consistently, not only around the Bay Area, but extending down into the Central Valley as well as up into the Sierra Nevada region. We also have had several students from the Southern California area, and we facilitate those placements as well. So we have a director of clinical training that assists with connecting you to the clinical training opportunities that best meet your learning needs and your future career needs. So the approximate time to completion, if you come in as an MSN, completion time is approximately 3 years. If you come in as a BSN to DNP, approximate completion time is 4 years. And then if you are doing a post-DNP certificate, the approximate completion time is 5 years. Now again, that is based on a standard graduate student progression. There are ways to go faster, and there are ways to go slower. And at University of San Francisco, you would work with your advisor to develop the curriculum pattern that works best for you. Next slide. Okay, so this just kind of shows you how those clinical practicum hours, where they're applied. You do 90 hours of simulation and learning and community-based work. That's actually the work I did today at University of the Pacific. I'm with the N735 students in advanced assessment and differential diagnosis. And then each semester from there, you do 135 hours of direct patient care. So those are the NP type hours. The DNP type hours, if you come in as a BSN to DNP and you are you're not doing a master's degree, you have these DNP practicum hours to complete that help you develop your project. If you come in with a master's degree already, if you're an MSN to DNP, we and you had clinical hours in your master's program, we apply those clinical hours to this 1,000 hour practicum requirement. And then we do calculations and see if you still need to do makeup practicum hours, and then we assign those as appropriate. And then if you're a BS into DNP completing the master's along the way, we apply your master's field work as some of those clinical hours. So these calculations are made on an individual basis with your advisor once you are admitted. If it's something that you would like someone to sit down and work with you on, what would my curriculum pattern look like, what would my practicum expectations be, if I'm coming in, you know, with this prior master's or in the MPH track, we're more than happy to sit down and do that for you. Next slide. And then just to give this is basically the same for the Psych Mental Health MP. It follows the same trajectory as the FMP. It's basically you start with your advanced assessment, 90 hours of community and simulation, and then you continue with 135 hours of direct patient care each semester. And the DNP practicum hours are exactly the same. Next slide. So again, to reiterate, all of our NP learners graduate with a DNP degree. And their role may be FMP or Psych Mental Health NP. So the requirement for the DNP degree is the curriculum that's delivered and the practice hours, the 1,000 practice hours, and the completion of a project, a DNP project. And what we're looking at is some type of evidence-based practice improvement project that moves the practice of the APRN forward. So you can see some of the, and what you do when you come in is you work with some people come in with a strong idea of what they want to do for their DNP project. They have an area of interest, they have implementation site in mind, and then you connect with your advisor who then helps you, either becomes your chair of your project or helps you locate an appropriate chair and helps design the project and supports you in the implementation of the project, supports you in the implementation supports you with the development of your manuscript about that project. I will tell you that is less usual than the learner who comes in and has a vague idea of their area of interest for their DNP project and some idea of where they might want to practice in their career. And then through the coursework, the early coursework really begins to hone their project area. So here are listed some sample projects: improving care for vulnerable rural populations with an environmental exposure assessment and clinical guidelines. So that learner worked very closely with one of our faculty who is an expert, an international expert in environmental health. Another is establishing a nurse practitioner residency program in a rural federally qualified health center, a feasibility analysis and pilot study. That learner, I can tell you, worked with me, and my area of interest is rural health and workforce pipeline. So what you can see is that we try to pair you up with faculty who have areas of interest that align with yours. And as Dr. Karshmer already discussed, we have a very strong faculty group with diverse interests. They are excellent scholars and very supportive educators. And now there's a comprehensive toolkit on hereditary cancers for primary care providers. So I will tell you the first two, improving care for vulnerable populations with environmental health exposure assessment and comprehensive toolkit on hereditary cancers, they both presented their DNP projects at the California Association of Nurse Practitioner March meeting, this last one in 2017. So what you'll find at USF are faculty that are very supportive of moving the students, the DNP students forward into dissemination. They help them publish and they help them present. And then the last one, educating nursing students and nurse practitioner faculty to help women with postpartum depression. Again, this learner was a psych mental health NP learner who worked closely with one of our faculty who is an expert in postpartum depression. Next slide. Okay, so applying to the program. Carolyn, were you going to take over that end?
Yes, absolutely. Thank you, Alexa. And so now I'll be talking about applying to the program. So we have here some admissions requirements. And we first want to just say that we take a holistic review of applications. So we really look at all parts of the application. We are asking and looking for at least a recommended 3.0 GPA, 3 letters of recommendation, documentation of active unencumbered RN license, a statement of purpose, professional resume, unofficial transcripts at the time of application. So during the time when you're applying, you would just need to submit unofficial transcripts, and if you are offered admission into the program, that is when we will ask for official transcripts. And then, of course, a completed application, which you will find online. Now, for the BSN to DNP option tracks, there are some additional requirements that for some of these tracks. But for the BSN to DNP, first we'd like to see your BSN degree from an accredited institution. If you are looking at and applying for the Masters of Science in Behavioral Health track, we would like to see college-level courses in both psychology and statistics or research methods. That's required. And if you look on the admission page, there will be specific prompts for the personal statement for the MSBH track or option. And then for MSN, and again, an active unencumbered RN licensed documentation, and must reflect the state where you plan to complete your practicum hours. And then if you're looking at the Master of Public Health track, fluency in a second language is helpful, but it's not required. And then once again, you can look on the admission page for personal statement prompts. If you're looking at the MS to DNP option, then we would need to see documentation, or you would have to have your MS degree from an accredited institution. Just going over some of the priority deadlines. For fall term, which usually starts the 3rd week of August, we're looking at a May 15th deadline. And then for our spring term, which starts in January, we're looking at a December 15th deadline. So those would be the admission requirements for the program. And at this time, we have, I believe I've just seen one question so far. So if anyone's listening and you have questions, this would be the time to type them in, and then I'll be asking Dr. Curtis. She wouldn't mind responding to some of these. So for our first question, we have from Nina. And you did address this, Dr. Curtis, a little bit earlier, but Nina's asking, is it possible to begin this program without experience? For example, I will be graduating from USF entry-level program in November, but would like to apply for the FNP program.
Yeah, well, number one, congratulations. I'm getting ready to graduate, and yes, like I said, that we don't require experience coming into the program. And that being said, so I want you to picture what this looks like. What we encourage is that you work as an RN during the program, and that just further feeds into your education as an NP. So most of our new grads that come in, they are also applying to work as an RN while they're doing the NP. Also, I know that the requirement for application is an unencumbered RN license. We do realize that when our new grads or recent grads, they graduate, they have to apply to take the NCLEX. They have to wait for their scores to come back. We will accept learners with a conditional admission that have just graduated from their pre-licensure program, and we'll accept them for the first semester pending passing the NCLEX score. So I hope that helps.
Great. And we do have some other questions rolling in here. So we have a question from Lisa. How many credits per semester would constitute part-time for the MSN DNP FNP program?
Again, the part-time option, thanks for the question. It's a great question because the part-time option really it means that you can decide how fast you want to go. You could take as few as one course, and you could take as many as, 4. That's a lot for a graduate program. And if you take a look at our curriculum tracks, and those can be made available to you if they aren't already, the unit load per semester varies a little bit, but it really doesn't vary too far from 6 to 10 units. So if you're part-time, you might take 3, or maybe it's a semester when the full-time graduate load is 9 and you take 6. It's really very individualized.
Great. Thank you for that. And we have a question here from Deirdre, and she'd like to know, do you help place students at clinical sites?
Yes, and that is a really great question, and I encourage anyone listening to continue asking that question. As anyone knows about NP education, the biggest barrier is clinical placement availabilities, and one of the best organizational supports that we offer is we have a director of clinical training who assists students directly with the placement into clinical sites. We have a database of clinical sites, but we also work with students who, if they say, hey, I want to work in this location, or I have a contact here, or I'm really interested in this specialty, then we work with you to help make that clinical placement work for you.
We have another question by Lisa, who asked a question earlier. So thanks, Lisa. And Lisa would like to know, do students who complete the MSN to DNP FNP program have to also complete the postgraduate certificate?
No, that's a great question, and it is all I understand that it is confusing. No, you're done. If you do the BSN to DNP with or without a master's in the middle, then you sit for national certification and you graduate with your DNP degree. You're done. The the certificate program are people who come to us and say, hey, I've already completed my DNP and I would like to do the nurse practitioner. And then what we do. And so that's a 5 semester. The other part is some people will come to us who are already FMPs and want to complete that psych mental health DNP is a classic one. Then what we do is we sit down with the applicant and do what's called a gap analysis and decide which courses need to be taken to meet the criteria of the program.
Okay. Alex would like to know, why should I get a master's degree if I can just get a DNP without the master's?
It's a great question, and that's a very individual decision. There is no practice reason in terms of you can hold yourself out as an FMP or a psych mental health MP with a doctoral degree without a master's. The only reason to receive a master's along the way is if you have a specialty area of interest. For the CNL, it would be more leadership. For the MPH, it's more population health. For the Master of Science Behavioral Health, it's becoming an expert in integrated behavioral health and primary care. MSBH, they focus on things like the management of chronic pain, which you probably heard a lot about with the opioid crisis, substance use in the community. So that master's gives you a specialty area. And the other thing that I find helps is if you do the master's along the way, the master's helps you start your DNP project, because what we like to do is take your master's capstone and then move that forward to your DNP project. But there's absolutely no required need for you to do a master's along the way from a BSN to DNP.
Great. Nina has another question, and she'd like to know, is there a way to bridge the current program at USF to the FNP DNP programs? And I believe Nina was the student who is in the master's entry right now.
Yeah, I think that's an ongoing discussion, and yes, I think what I would like to do with any of our USF pre-licensure students in the master's entry program, I'd like to address that individually with you, because yes, there are ways that we can move you into the doctoral level classes, but so that we're not repeating coursework, but that needs to be done individually, and I'm happy to talk to you about that.
Great. And then we have a question from Kyun Lee. I am from Southern California, applying for the MSN to DNP FNP program. I was wondering, does the 2 in-person meetings on the weekends per month throughout the entire 3-year duration, or does it start, say, when the FNP courses are introduced during the 2nd semester?
That's a great question. You guys are full of really great questions. No, the NP 2 face-to-face meetings per month starts with when the NP coursework starts. So that would start with 735, 736, which is advanced assessment, and then would continue on for 4 more semesters. So it would be 5 semesters of every other weekend. The rest of it is once a month synchronous. Some of that once a month synchronous is seat time, required seat time, but a lot of the DNP synchronous can be done by Zoom as well. And like I said, we've had several Southern California learners complete our program.
Same person is asking, how many credits may I transfer from my MSN degree to the DNP FNP program?
Okay, good, great question. We accept up to standard university policy across universities is 12 credits can be transferred.
Let's see. And then we have one last question from Yesenia. Do you have any opportunities to have clinical practice abroad?
Another good question. That is one of the benefits of having an MPH program in our School of Nursing and Health Professions. We have MPH immersions, and we can tailor. Our NP learners can participate with the MPH immersions. We also have, and we continue to develop those international immersions along with our MPH faculty. One in particular that we're working on is a project that I worked on is with one of my first DNP learners at USF. We helped open the Bwindi School of Nursing Uganda, and we have clinical practice opportunities at the Bwindi School of Nursing Uganda and the community hospital there. So yes, we have those, and we are continuing to develop them.
Great questions. And that would be it for our questions. So I don't think there are any more coming in at the moment, and so we may be ending our Q&A session right here. So thank you, Dr. Curtis, for answering all of those questions, and like I said, thank you too for all of the attendees who asked very thoughtful and insightful questions. And I just wanted to let all of you out there know that if you have any other questions, if they are application related, you can contact our School of Nursing and Health Professions graduate admissions team at sonhpadmissions@usfca.edu, and that's on the slide right there. And then for program-related questions, you can contact Dr. Curtis or Dr. Karshmer, and the contact information is right there as well on the screen. Leave that up there for a second. And also, like I said, this will be recorded and will be put up on our website, and so everyone will have the opportunity to take a a longer look at these slides. But at this time, I would like to say thank you so much to Dr. Curtis and Dr. Karshmer for a wonderful presentation. And I want to thank all of you, all of the folks out there who have attended this webinar, and just for your time this evening. We hope that it was helpful. If you have any questions, please do not hesitate to contact us. And like I said, all of the attendees out there will be receiving an application fee waiver in hopes that you would find that this program is a good fit for you and you will consider applying to our program. We are currently accepting applications for spring, and spring starts in around the third week of January, and application deadlines are December 15th. So thank you, and I hope that everyone has a wonderful evening.